Hello, my friends. Good afternoon. It's afternoon here in UK, or maybe morning somewhere else. How are you all? I hope you're all fit and well and happy. I hope you have gone over my two previous videos and had some benefit from them. As I promised last time, I'm going to talk about pain management. Pain management is a very important subject, I think. Personally, I'm very passionate about it, and it is very dear to my heart, and I've spoken about this in a lot of times in international conferences and teaching people and so on. In this video, before I start doing anything, I hope you can actually I want you to agree with me on the following things about pain. First of these things, I think we'll all agree that it is not very nice to have pain. That's obvious. It's a terrible thing to have. It really screws your quality of life. It's not nice, and this is, everybody knows that, and that's why actually people use this as a kind of torture. And I'm sure you have heard about things horrible being done in Guantanamo and the Syrian prisons, and then by the Gestapo and the Israeli prisons as well, and so on. So it's not very nice thing to have. The only problem is that it is made to make bad things to people, which is really not very good. The next point is that it's very common. I think it's the commonest symptom with the commonest presentation to hospitals, either to emergency or to clinics. By far, I think. I don't have any numbers, but I think by far it is the commonest presentation. The third one, I hope you can actually see it in the whiteboard, it can actually present to all specialties. Every specialty doctor actually sees patients with pain. That includes surgeons, obstetricians, pediatricians, gastroenterologists, neurologists, neurosurgeons, dermatologists. I think dermatologists, they have like herpes zoster is painful, so it is their specialty. I was trying to find some for the psychiatrist, but unfortunately I just couldn't. I hope if any psychiatrist can actually tell us if they deal with patients with pain. I'm sure they deal with mental pain and the pain of the soul and all these cryptic things. So to present to everybody, so this video and the coming videos might be relevant to all these specialties. Number 4 is that everyone feels the pain. There is misconception again that neonates don't feel the pain. Very elderly people don't feel the pain, but they do feel the pain, and they need their pain to be managed. If there is an elderly man there having pain, don't say, no, this guy is, I don't think he needs to be treated urgently or something like that. But they do feel the pain. If the elderly man tells you have pain, he has pain. And the fifth one is not managed well. There is thousands or hundreds of papers which can tell you that pain management is suboptimal all over the world. Everybody is having a raw deal when they go to hospitals with pain. It's not managed very well, and I think in the next videos I might tell you why this hasn't been, why it hasn't been managed very well all over the world. So this is really important. The sixth one, which is, I think, is the most important, by far the most important, and I really think that's one of the things that pain is not managed very well. That's one of the main things. Okay, it is totally, entirely, to my mind, entirely subjective. There is no measurement tool by which you can actually measure pain. There is no test which can tell you how much pain the patient is in. Nothing at all. Subjective, that means the patient who will tell you how much pain he or she is in. Okay? Now there are some papers which say that pain, if you have pain, then your blood pressure goes up. If you have pain, your pulse goes up. If you have pain, your respiratory rate goes up. I've seen those papers, and I think the nearest one is the respiratory rate, nearest correlation. But even that is very tenuous. It's not convincing whatsoever. So again, I come back to the fact that it is completely, totally, entirely subjective. What does that mean? It means that when the patient tells you, I am in pain, okay, then I expect you to ask the patient how much pain you're in. Important, because you need to know how much pain so that you can actually give the appropriate treatment. To ask that question, you say, okay, you have pain? The patient will say, yes. So we'll say, how much pain you have? Can you tell me how much is your pain? In the scale of 0 to 10, okay? Scale of 0 to 10. If 0 is no pain at all, 0, you don't have any pain. And 10 is the most severe pain you had in your life. Terrible pain, the most excruciating pain you have had, or you will have. So how much is your pain in this scale from 0 to 10? 0, no pain. 10, very, very severe pain. Then the patient will say, is 6. And patients, by the way, are very accurate in assessing their pain because it is their pain. So if the patient says the pain is 6, and he's like just sitting comfortably in the bed looking at you, don't say, this guy is telling me lies. How come he's very comfortable and he says his pain is 6? No, his pain is not 6. It might be 2 or 3, so I'll give him some paracetamol or something like that. That's not good. For those who speak Arabic, and then there is an Iraqi poet who says, لا تشكل الناس جرحا أنت صاحبه لا يؤلم الجرح إلا من به ألمه لا يؤلم الجرح إلا من به ألمه, which means in English, the pain pains those who have the pain. I don't know if that makes sense, but which means that if you have pain, you are the only person who feels that pain, nobody else. And you as a doctor, if you don't feel the pain, you have no right, you don't feel the patient's pain, you have no right to say his pain is 5 or 7 or 8. So if the patient tells you it is 10, it is 10. So you need to know what to give when the pain is 10 and so on. This is really important because it has a lot of bearing on what I'm going to do in my coming videos. So I think I'll stop here because I know the attention span of many people is not that long. Most probably now it's just over 10 minutes. So I'll stop here. And until I see you next time, please take care, sleep well, eat well, go to the gym, be healthy and be happy. And until that time, I wish you goodbye, cheerio, and hasta luego.